Once the slice is selected, spatial location of spins with the slice is determined by using the gradient. And when the gradient is switched on, precisional frequency is determined by its physical location on the gradient. So we have the phase encoding gradient here. So on that, where which place the nucleus is there, the spin of the nucleus is there, that is determined by the phase. So that is what is actually meant by phase. So at what phase is the spin of the nucleus is at a particular time. So that is what is shown here. So nuclei travels slower and that loses phase, and this is when it is in the straight this thing, and nuclei travel faster and gain phase. So you can see that when it loses phase, it comes to anti-clockwise 9 o'clock position, and when it gains the phase, then it comes to the 3 o'clock position. And when it is in phase with the applied gradient, then it is at the 12 o'clock position. So this is based on how you set your system. So this can vary from machine to machine, how the commissioning is done and how the calibration is done for the phases. So the value does not matter, but how you set it across, like whether it is a phase loss or a phase gain, or it is in phase with the applied gradient. And the resultant of that will give us the phase of the resultant phase of the nuclei, or whatever net phase is there, that we will get from the resultant of all these at different. So different phases are given across the different gradients or different magnetic field strengths. So then accordingly the nucleuses which are in phase, or it gains phase, the net magnetization is there, or it loses phase, the net magnetization is negative. So that happens, and the resultant we get for the actual this thing. So from that we will be able to understand how much variation is there from the actual one and its position. Gradient changes the phase of magnetic moment of each nucleus. A nucleus that experiences a high magnetic field strength when gradient is on gain phase relative to its position without gradient is on. And if a nucleus experiences lower magnetic field strength with gradient on, its magnetic moment slows down and it loses phase. A phase gradient produces a phase shift of spins along the gradient. Phase shift is used to locate the nuclei spatially along the dimension of the image. So slope or amplitude of the phase encoding gradient determine the degree of the phase shift. So this is what we have seen in the previous image, exactly what. And the next is the frequency. So the gradient causes a frequency change or shift in how we are going to discuss. When it is switched on during an echo, often called readout gradient, because during its application, frequencies within the signal are read by the system. So here the gradient is switched on and the nuclei in column X precise at frequency X is there at the first rectangle. Nuclei in column Y precise at frequency Y, and nuclei in Z precise at frequency Z. So frequency encoding gradient. So yesterday we have seen once the resultant of all the coils and everything, the RF resonance and all that is, we get XY, the columns, rows, and in a three-dimensional phase with respect to frequency. So we have the phase information, we have the frequency information for each slice. And the K-space characteristics, The K-space is an area where data are collected from the signal that are stored. It is a spatial frequency domain where information about the frequency of the signal, where it comes from the patient, is collected and stored. K-space is an area where the data are stored until the scan is over. The lines nearest to the face are called central line. The lines farthest from the face axis are called outer lines. K-space lines are usually filled linearly from top to bottom or from bottom to top. This is called conjugate symmetry. So we have seen in this picture. Here, this is the final result. We have the phase information, we have the frequency information in rows and columns. So how this is encoded? So that is while the scan is going on, it will get filled from one side to the other or from the other side to the front. So this information is, while the scan is going on, wherever it is saved, that space is called the K space in simple terms. So this is it. So which is along the face, it is called the central line, and the which is farther are called the outer lines. So the signal to noise ratio and the contrast are the resultant of this information. So contrast is how dark or light, the difference in darkness and lightness of two objects. And resolution is how well we are able to differentiate two closely placed similar objects as two individual ones. So I think you understood. Two people, say Harshita and Vishwa, are sitting together close to each other. So when you are looking at it, so how well you are able to identify Harshita as Harshita and Vishwa as Vishwa is resolution. And contrast is how much clear you are able to see each person, that is contrast. So the noise or the unwanted information or the extra information which might get saved on the K space will deteriorate this quality. So how well we are able to differentiate or identify or see the details, that will be affected by the additional information or additional signals which are stored in the K space. That is called noise. So this is again image contrast and resolution. So we have seen contrast is how well we are able to see the white and dark things clearly. So the degree of whiteness or darkness is contrast. And resolution is two nearby objects, how well you are able to identify each of them as separate things, that is resolution. The K-space filling and signal amplitude. The center lines of K-space are filled with data produced after application of shallow phase encoding gradient slopes. Outer lines are filled with data produced after application of steep phase encoding gradient slopes. And you may all be familiar with Fourier transformation. This is one of the most commonly used tool to do image processing. So in Fourier transformation, signals received in MRI are in the form of amplitude with time, and Fourier transform of these signals can be represented as strength versus time. So how much is the height of the signal, and at what time how much height is there for each of the signal. And the Fourier transform converts the data in the time domain to frequency domain. And we are coming to some of the recent advances in MRI. So see, basically the fundamental principles all remain same. So depending on our clinical requirement, we will modify these things for us to get whatever desired output we need to get out of it, or whatever desired input we need to get out of it. We have to enhance some contrast, reduce some other contrast. We have to see between two things where the differences are low, all for in order to achieve whatever information we need. We, like, there is a fixed pattern when it is when the body is under the influence of the external applied magnetic field, and with all these things. So we have all these parameters. We have shimming coils, gradient coils, and shifts in this thing. So all that we can increase, decrease, or keep it straight so that we get the required information out of this. So those are what led to these advancements. So MR spectroscopy is there, MR angiography is there, magnetization transfer contrast, ultra fast imaging sequence, functional study, MR perfusion, MR diffusion, dynamic imaging, MR hydrography, MR therapy without the use of contrast medium. So all these are like initially MRI was used for anatomical contrast. So in CT, we may not be able to appreciate two similar tissues differently, like the contrast and resolution among normal tissues, like different types of soft tissues, may not be that great in CT. So there we need more of a contrast and resolution. So first MRI came to aid for that. We can differentiate between two types of soft tissues better in an MRI image. So this was again an anatomical or morphological imaging. Then as the field strength increases, we are able to adjust all these things. We are able to capture all these changes very fast and take out information out of that. So the functional information from that, how the heart functions, how the blood flows, all this information we are able to interpret from the data we acquire by changing one or more of the parameters which we are applying, and the corresponding results we are receiving. So we say that the functional cardiac information and all is possible to get from 3 Tesla MRI. So previously, in order to get if there is an ischemia, or if there is a perfusion defect, or is there is a block, but it is a reversible block. When the patient stresses only, the block is coming, or when the patient is relaxing also, the block is there. So all those things we need to do another studies to understand. There used to be a treadmill test, stress treadmill test, rest treadmill test, and all those things. So now this can be replaced with MR scanning. So a person who is having a cardiac problem, who finds it difficult to walk, he or she needs to be running on a treadmill is not an easy task. So by doing a cardiac MRI, we can easily get those information without having much difficulty on the patient side. And other advancements are EPI, MR guided interventional procedures, development in the coils. So there are more development in the type and kind of the coils which we use. So this is to the signal acquisition from the body. If coils are not there, that will be weaker. So when additional coils are added, that is again helping to remove the unwanted interferences and strengthens the signal which we are receiving from the body. And parallel acquisition technique, high Tesla MR, open MR, mobile MR, PDRI, a method for imaging free radicals, PET MRI, field cycle MRI, even MRI linear accelerators have come into picture, where we are treating the cancer patients using the radiotherapy linear accelerator, where an MRI machine is embedded. So the MRI imaging is helping to track the tumor or track the normal structures, the critical organs, while delivering the high radiation doses to control the tumor. So coming to magnetic resonance angiography, or abbreviated as MRA. So different techniques use different phenomena. So DSMRA is there, TOF MRA where 2D and 3D images are taken, PCMRA, CMRA. So these use the velocity encoding techniques, and MR spectroscopy, like there it was MRA and here it is MRS, is a non-invasive technique to determine the molecular metabolites, which are measured due to their slightly different magnetic frequencies or chemical shifts. So this is a very minute phenomenon which is happening. So that could be detected and made into an image format by using an MRI. In many pathological process, metabolic changes pre-coded anatomic changes during disease progression and treatment. MRS offers a method for early detection of new diseases and can influence the therapeutic success or failure. So the meaning of this is, many a times we understand that we have a disease when we have some symptoms. We have pain, we have other problems, we feel full, we feel suffocated, we feel difficulty in swallowing, we feel difficulty in breathing, whatever. When we have signs and symptoms, then we realize that we have a problem. So that time the disease would have come to a good extent or a advanced stage. But the advantage with MR spectroscopy is, when the normal functioning of any of the cells or any of the chemicals in the body changes, it may not directly result in a sign or symptom for the person. But in MRI, we can detect these changes as early as before it manifests as a sign or symptom on the person. So we can detect it early, and based on that, like we can understand how it is going to change or how it is changing in or changing over a period of time. And so based on the information we get, we will know, okay, what treatment needs to be given, or how good the one particular treatment will be for the desired effects in that particular disease condition. All this information can be availed. The principle is the chemical shift giving rise to separate peaks in MR spectrum. It is due to the interactions with a neighboring nuclear spin and provides additional information. The MR spectra are analyzed, and the center of the resonance frequency, peak height, line with width at half height, and peak area and shape, compensation of the peaks. All this information we can get, and which we can use to understand and identify the disease as well as its prognosis, and probably the response or the expected response pattern to the treatment which we are giving. So this is how the chemical shift, we will get peaks like this. So depending on where the peak is, what is the height of the peak, what is the breadth of the peak, what is the difference between the positions of the peak. So all this information will act as valuable tools in identifying the disease or in a decision making process in deciding what treatment protocol needs to be followed. So this is some of the images. So that differences will picturized as this. So wherever there is a low activity, there is a high activity, there is high net magnetization, less net magnetization, all that can be seen. And with the help of additional contrast agents or manipulation with the techniques, the shifting, the shim coils or gradient coils, the signal applied or the RF pulse changes, we can get further information on how that exactly is, and sometimes how it acts from time to time, whether there is blood flow to that, whether there is no blood flow. All this information we can get from this imaging. So the clinical applications of MRS, it provides biochemical information to assist in the differential diagnosis when standard clinical images fails. for evaluating and monitoring the progression of stroke. What is stroke? Someone? Ischemia. What is ischemia? So different things can cause stroke.
Shortage of blood
So if
flow to the heart.
Yeah, ischemia is the reduced blood flow to wherever it is supposed to be. So the cardiac ischemia is when the heart muscles are not getting sufficient blood supply. That is what is causing heart attack in most of the cases. So this that is because thickening or thinning of the blood vessels and all those things. Then stroke is when this the where there is a clot and
When
block,
blood flow to
or
brain.
yeah, where there is a
Blood flow
clot
to brain.
to the blood supply, or where there is a clot and the pressure increases and the blood vessel blast in the brain, a stroke happens. So this will affect the normal functioning of the system, and then the function will impair, and that is what is called a stroke. And ischemia is when the reduced blood supply causes problems, especially to the heart. And brain tumors, any additional growth or malignant growth in the brain, epilepsy, where there is neurological changes that causes signs and symptoms of epilepsy, and white matter disorders, Alzheimer's. You can know that all these are neurological changes which happens, and the effect may not be that great. It will be a very slow process. So all these things can be understood. The signs and symptoms for that, we can understood and identify them much before the person is affected by the changes or degradation happening inside the body, and the signs and symptoms occurs. HIV infections, drug addictions. So you know that all these are also kind of neurological disorders. So, and these changes, the minute changes in the system might not be that visible. We might not be able to know otherwise, but this MRS imaging helps us to identify what exactly is the problem. So once we identify that problem, we can treat accordingly. We will know if this treatment is given, it will be beneficial or not, or we should go ahead with another treatment methodology, or we should just try to not try to reverse it, but keep it the progression slow, or whatever line of treatment techniques we have to follow. And high Tesla MR, we have ultra high field MRI provides unique advantages that can be used not only to obtain better results for many current diagnostic applications, but opens up new fields of activity by enabling previously unattainable applications. Researchers are investigating and already showing promising results building on the advantages of ultra high field strength MRI studies. Structural imaging, so morphological applications such as degenerative neurological diseases like Alzheimer's disease, Parkinson's disease, and multiple sclerosis. And new areas of MRI research include high resolution vascular imaging with opportunities for direct anatomic visualization of angiogenesis of the microvasculature, and monitoring the structural effectiveness of anti-angiogenic and genetic-based drugs for the treatment of cancer at an unprecedented level of detail. So this might seem little complicated, but in nutshell what it is, cancer is uncontrolled growth of cells. So once the cell starts dividing, it's uncontrolled. The cells just go on dividing and producing more and more number of cells. So there may not be sufficient amount of blood vessels to supply blood to these new cells. So some of them start necrosing. And over a period of time, if there is some cells which are not oxygenated sufficiently, so the body's natural mechanism is try to provide blood to that, so that required oxygenation will happen. It will not be that okay, these cells are malignant cells, so we will not provide blood supply to that. That may not be the situation. So the formation of new blood vessels or blood supply to these uh, proliferated cells starts to form. That is what is called angiogenesis. And then another thing is this when the tumor becomes completely uncontrollable and at a very fast rate it proliferates, more and more cells becomes, and the blood supply will be towards only at the peripheral side or at the outside most part of the tumor. So what happens, most of the treatment modalities, surgery is different, but either chemotherapy, radiotherapy, hormone therapy, any of these therapeutic modalities has a role when that the efficacy of these treatment modalities will be depending on the basic nature of the cells also. So in another words, in simple terms, we can say that if there is good blood supply, more chemicals will reach the place and damage the cells. And radiation also, if there is oxygen present in the cell, the damage will be more. So like that. So once the peripheral peripheral cells which are oxygenated gets damaged, then the blood supply will go to the next level of peripheral cells, which is now the peripheral cells. So once there is sufficient supply, then we can give the next cycle of chemotherapy or hormone therapy or radiotherapy, then that cells also will damage. So that is why these cancer treatments are over a period of time to get the desired control of the tumor. And all this information can be achieved in that precisional level, like once the cell size is like in the order of minus 10 to minus 15 nanometers. So at that small level, whatever differences are there, we are able to identify them using this high Tesla MR, where 7 Tesla or 8 Tesla are utilized. But just to like, it is not commercially available. This is in the research and development phase, and it is not approved for human uses so far. I think the animal studies and other studies are going on. 7 Tesla MR molecular applications such as quantitative imaging of gene expression, marking stem cells and tracking their evolution, or targeting malignant cells with targeted contrast agents will be facilitated due to the tremendous increase in signal to noise ratios as well as the new possible contrast mechanisms. So what is happening is the same. There is a net magnetization in the body. When the body is placed in the high magnetic field, it gets aligned. Then the RF pulse is applied. When the RF pulse is removed, it comes back to its normal positions. So the problems with the contrast and resolution at the micro levels, that is addressed with high Tesla MRs. So like, and in order to help that identification of this, we can use contrast agents, some target agents, some chemicals, not like we inject into the vessel and it will go wherever blood supply is there. Some of them will get absorbed only in certain this things. So only if there is one particular type of modification or a difference or disease condition, that will be seen. So otherwise it will get out of the get out in the blood supply itself. It will not go into anywhere else. So all these things are possible. So we are manipulating the features and adding additional features to get the desired outputs or desired result. Yes. These machines also looks the same, almost like how the normal MRI machines looks. And there are mobile MRI machines also now, and compact MRI machines, very compact MRI machines. So the magnetic assembly is very huge. So you know that for a human body of maybe 30 centimeter width and 30 centimeter this thing, and the length of 160 to 150 to 180 centimeters or 190 centimeters, you need to have a huge magnet. And open MRI has become the best option for those patients who are claustrophobic or for children. The basic technology of an open MRI is similar to that of a traditional MRI test. The major difference for the patient is that instead of lying in a narrow tube-shaped structure, the patient lies on an imaging table with more space around the body. Just above the patient is a large round mechanism from which electromagnetic waves are transmitted. Like the traditional MRI, an open MRI test is also painless and does not use ionizing radiation. Pre-testing preparations is the same for both MRI tests. So we have like 85 centimeter bore size, 1 meter bore size, like that MRI machines. So when the patient goes inside, they might feel claustrophobic, something is falling onto them. So that could be, with higher, bigger bore sizes, this could be avoided, and that is achieved by the open MRI techniques. And here you can see that it is not in the circular form like the other one. There can be different shapes and these things, that is depending on the vendor how they want to design their equipment parts. So you will not feel that you are going into a hall. You can see the other side, all sides, only above and below there will be magnet, and the strength of those magnets will be high and the field strength will be higher, so that you will get the desired results. So this is more like a gamma camera or a linear accelerator where you will not feel that claustrophobic. Huh? Yeah, the B naught will be the same. It will be along this direction or this direction. So where how we will place the head first or foot first orientation, whatever orientation we have to do, the direction will be like this. Then accordingly X, Y and Z gradient coils will be there. No. So the B naught direction will be like this. It will be same as that. It will be same as the ring gantry specification. There will not be much. And see, these things does not matter much. These are actually like how it is. Accordingly, your other features also will vary slightly. And when some particular company develops one model and they have to take patent for that, that needs to be, there needs to be some different from whatever existing models, no? So there will be slight variation. So you cannot say that it has to be in this direction. So one company will come up for a new patent, they will put it across and they will say we, our parameters or our features are different, it is better, it is this has this advantage, that advantage, like that. But the basic fundamental principles remains the same. And PET MRI, PET scanning allows more precise determination of whether a given tumor is cancerous, whether a cancer has spread, and if so, how extensively. In addition, a PET scan allows the physician to determine whether a cancer has responded to treatment. So PET is kind of completely functional information. If something is active, it will be seen hot or dark or black spot. And if something is non-functional or there is reduction in the blood supply or something of that sort, then it will be seen as cold or non-active areas. So this is kind of completely functional information, PET. And MRI gives the anatomical information in the sense the contrast and resolution between similar type of soft tissues also. So a combination of these two will help in identifying, locating, understanding the nature and characteristic of whatever type of abnormality is there in the body. Especially in cancer and all, it matters because there may be a big mass as a tumor, but it may not be active, or it may not be that fastly proliferating. So all this information we can get by using PET, and MRI will tell exactly how much is the size, what is seen on this thing, and the PET will tell out of that size how much is really active at a particular point of time. So this kind of information we can get by fusion or hybrid imaging. Image fusion or hybrid imaging we call it. So PET MRI is an example for hybrid imaging. For patients with coronary artery disease and or for those who have had previous heart attacks, the PET scan can differentiate live heart tissue from scarring. So the scar tissue will not have any blood supply to it. So the isotope will not go there. So you will see it as a blank space on the image. Where there is blood supply, there will be the presence of the radio tracer. You will be able to pick that up. And if there is more blood supply than normal, that also we will be able to identify. If the cell turnover is more, that also you will be able to understand. So it is a real functional level information, and this information also can be attained with when it is at the very early stages before the changes brings in any physically observable signs and symptoms on the person. So this helps the cardiologist and cardiac thoracic surgeons to determine whether coronary artery angioplasty or bypass surgery can be beneficial in improving the function of the heart. So if the cell is dead because it was not getting blood supply for a longer time, then there is no point in doing a bypass. But if we know that if we restart the blood supply, then those cells can start functioning normal. So there is a point. So depending on that, how you will do the grafting, how you will do the bypass, all those things can be uh, adjusted, and the resultant outcome will be better. Previously, we will not know. We will only know, okay, there is a block. So we bypass that block. We will get a functioning cardiac tissues. But now, before doing the surgery only, we will know once we restart the blood supply, whether the tissues there will start functioning normal or not. So depending on that, the treatment modalities can be changed. So MRI guided coronary balloon angioplasty and PEDRI. So we have seen in the list that it is the method for imaging free radicals. And free radicals are defined as molecules with one or more unpaired electron in their outer orbit. So because of this property, they tend to be quite reactive. So free radicals are, like we have studied in school, like free radicals are very active particles because of the unpaired electrons in the orbital. And free radicals are involved in normal metabolism and are always present in the human body, but normally at very low concentrations. There is considerable interest in free radicals among the medical research community because changes in their concentrations are believed to be involved in the early stages of many diseases, including cancer, inflammatory disease, heart disease, and many more. So if we can identify those changes at an early stage, we can prevent them further worsening and developing the disease conditions. So the full form is proton-electron double resonance imaging. So in MRI, the normal MRI, what we are doing, the proton resonance we are making use of, and in PEDRI, proton and electron double resonance imaging is a technique for imaging the distribution of free radicals within the body. So it is able to detect low concentrations of free radicals and can also produce very high quality images showing the distribution of free radicals in large samples. So PEDRI makes use of a double resonance magnetic resonance technique called the Overhauser effect. So just assume it like this. When we have only the proton resonance, we have a lot of information which is enabling us to get lot many of the details of the anatomy or physiology. So when we have the electron resonance, in addition to the proton resonance, we have more information and we can enumerate more information about the inside of the body from that. So the principle behind this double resonance technique is the Overhauser effect. So that is essentially a combination of nuclear magnetic resonance and electron spin resonance. The NMR signal is obtained in the usual way by applying pulses of radio waves at the NMR frequency. At the same time, the free radicals unpaired electrons are irradiated by applying an irradiation, radio wave or microwave, at the ESR frequency or the electron spin resonance frequency. So if there is good magnetic coupling between the unpaired electrons and the water hydrogen nuclei, the ESR irradiation can cause a transfer of polarization from the electrons to the nuclear spins, resulting in an amplification or enhancement of the measured NMR signal. So in theory, the enhancement can be up to 330-fold, though in practice, enhancement factors of 10 to 50-fold are more commonly observed. So this is theoretically we can have 330-fold amplification or difference or contrast or resolution we can say, but we are not that technologically advanced to make use of that 330-fold difference. So we can get up to 50-fold very accurately and commonly. But you know that 50-fold more information is also good enough to understand many of the cases. And these images, the images normally use low field magnets with magnetic field of about 0.01 Tesla as opposed to the 1 Tesla or so used in clinical MRI systems. So this is because the ESR frequency is 659 times the NMR frequency in a given magnetic field. So in a 1 Tesla magnet, the ESR frequency would be 28 gigahertz, well into the microwave part of the electromagnetic spectrum, which would cook any biological sample being imaged. And reducing the magnetic field to 0.01 Tesla brings the ESR frequency to a more manageable 280 megahertz. So this is another thing which we need to understand. When we talk about MRI, we will say there is no radiation effects. It's safe to use. There is no side effects, this and all. Thing is, there can be effects. Like, it is not ionizing radiation which we are using, but because of this magnetization, demagnetization, application of resonance signals, RF pulses, what changes it produces in the body and how it can have a negative impact in the future, we do not know because we do not have knowledge about that minute levels. Whatever changes are there, they are very minute and it may not directly result in any serious changes. So, but when we are talking about, when we are taking the NMR as well as ESR together, so if normal 1 Tesla MRI and the ESR frequency, which is 659 times higher, so that will be like cooking the tissue. So much of heat can be produced over there and then the changes, the released energy, additional energy there which can damage the biological system. So we have to bring it down to very low levels. 1 Tesla ki jagah not 0.1, 0.01. It's like 100 times lesser the magnetic field strength, so that we can utilize the electron spin resonance also for our advantage. And the advantages of PEDRI are over the direct electron spin resonance based free radical imaging technique is that the image formation is entirely by NMR or opposed to ESR. This means that the spatial resolution is independent of the ESR line width of the free radical under study. Another related advantage is that PEDRI can make use of standard MRI pulse sequences, including rapid imaging techniques. Okay. We'll stop here for today. We'll discuss this from tomorrow. Tomorrow is Saturday. You have class tomorrow?
One class would be there around 12 o'clock.
Okay. You want okay, then we will have it on Tuesday, no? Tuesday is our class is scheduled for, right?
Okay, ma'am. Thank you.
Yeah, we will have the next class on Tuesday, 2 o'clock. If there is any
Okay, ma'am.
difference, I will let you know.
Okay, ma'am.
Okay.
Okay, ma'am. Good evening, ma'am.
Good evening.